Hi, good morning, students. Thank you for your great discussion board, back and forth. I really thought you guys did a great job. The reason that I had you do that is because you're going to find that when you are interacting with patients in the hospital and their families, that they're going to have strong opinions about things that are happening with current events or with different disease, different diagnosis. You might find that when you're assessing your patient's A&O, we used to say, well, can you tell me who the president of the United States is? And those kinds of questions right now can be upsetting to a patient. And if you find that you feel strongly one way or the other about certain issues too, it may be difficult for you to sort of check your emotions at the door regarding that stuff too. So that was the point of that exercise. People feel strongly about the COVID vaccine right now, and people feel strongly, including healthcare providers, about certain diagnosis like obesity or like a smoker who comes in with with lung cancer, where certain people feel like if if lifestyle modifications were made, that possibly the patient wouldn't be as sick. So that's why I had you sort of talk about that and just understand how sensitive we have to be and how we just want to have an awareness of how we feel too, and think about if there's certain things where we feel strong about issues, just making sure that that isn't reflected in our patient care. So that was the point of that. Now what I'm going to do for you guys is I'm going to share my screen, and I'm going to go through a little bit of how to tackle those difficult test questions that you guys are having in nursing school and later that you'll have on the NCLEX. So I may talk kind of fast through this, but you'll have the recording, obviously. So if you want to go slower and kind of think about this yourself, students in the past have told me that this sort of thing has been helpful for them. So I'm going to kind of teach you about how you can break apart a test question, but also I want to let you know that this guidance that I'm giving you on how to sort of tackle these questions is when you don't know the answer. So if you come to a test question and you immediately know what the answer is, just choose it and don't go through any of this. This is more for trying, if there's tiebreakers or prioritization questions where all of the answers are right. Also, what students tell me, and I know that when I was in school, this happened to me too, I could almost always get it down to 2 reasonable answers, and then just trying to figure out which one to choose, I'd inevitably choose the wrong one. So let's get started with this. So there's different parts of the question. The stem is the part that actually asks the question. And then you're going to get what's going on with the patient right now, the scenario, what is their situation, what is their condition. And there's very often going to be distractors in the question as well. And those aren't the right answer. And an example of a distractor would be that if they're asking you for, I kind of getting ahead of myself here, but if they're asking you for an intervention and some of the answer choices are signs and symptoms, those aren't going to be right. You can just cross those out right away. Also, again, this is if you don't know the answer. Very often, if the answer choices are opposites, like tachycardia, bradycardia, one of those is going to be the right answer. Okay. So those prioritization questions, can be tough because the patients, they give you a list of different patients and they all need your attention, and they all need your attention, but it's just trying to figure out who to see first. And you'll be able to recognize these questions because they're going to have words in them, like initial, first, priority, that sort of thing. So the ABCs, airway, or problems with being able to breathe, are going to be first. And then you can go through, I know you guys learned this recently, Maslow's hierarchy of needs. So it's a physiological needs. Obviously, they're going to come first. And then you want to remember that you always, before you can do any action, you need to use the nursing process with these questions, and you always want to assess first. So before you're going to do any, even call the doctor or call a code or administer medication, you're going to make sure that if it's a question that's asking what you're going to do first, that the assessment is first. Now, sometimes there'll be tricky questions where in the body of the question, it will say right in there, you have already assessed or you have performed a full physical assessment. What will you do next? The answer isn't going to be, oh, I have to remember I always have to assess first, because you already did. So you wouldn't choose reassess the patient because it just said you already did. So you want to kind of determine where you are in the nursing process when you're reading the question too. Okay, so prioritization questions will often have age, gender, diagnosis, and a modifying phrase. So the first thing I want to tell you is age and gender, it doesn't matter. You know, and oftentimes they'll say like a young male, you know, compared to like an elderly lady, and really it's the young male who's the priority, but they're just kind of trying to distract you by that. So age, gender, not important. What is important is what is the modifying phrase, and I'll show you what I mean by that. So if you are told in a question that a patient has angina pectoris and myocardial infarction, which is chest pain versus heart attack, who has higher priority, you all know that it's going to be the person having the heart attack, right? Okay, so MI is a priority. Okay, so now let's add a little thing. Let's add the modifying phrase. So now the person has chest pain and unstable blood pressure versus a person who had a heart attack or is having a heart attack with stable vital signs. Who is your priority? You're always going to look at that modifying phrase. So even though this is a more serious thing that happened to the patient, we are going to go see this patient first because they have the unstable blood pressure. Let me show you some more. Okay, let's see. I'm going to give you 4 roles here for prioritization. Acute versus chronic. So whatever the situation is right now is going to be more important than a chronic condition, no matter what the condition is. Anytime a patient is in the first 12 hours post-op for anything, they're considered unstable. So that would be the unstable patient that you're going to see first. They might tell you right in the question, use the words unstable or stable, and then ask you who you're going to see first, because they gave it away for you. Always unstable. Okay. Then I was talking about if you get to like where you're trying to do these tiebreakers where both of the questions seem right, it's there are some organs that are more important than others, and the more vital the organ, the higher priority if everything else is the same. So I put a list for you here of the vital organs in order on which ones are the most important. The brain is first, lung, heart, liver, kidneys, and pancreas. That's the order if you get down to a tiebreaker. So anything with the brain is always going to be your priority. Okay, give you the answer there, but now let's just look at different situations where the patient might be in the hospital. They might have a diagnosis of COPD, which is bad, right? It's with the lungs. CHFS, oh, that's a bad condition too with the heart. But appendicitis is an acute situation where something is happening right now with the patient. And if you've ever had appendicitis or seen a patient or known anybody with it, it's extremely painful. And we're worried that that might rupture, right? And the patient could become septic and it could become a medical emergency. So if they are only giving you these 3 things, even though we know the appendix, you can have it removed, it's not a vital organ. In this situation, this is the priority patient. Okay, here's another little exercise for you to which one's the priority. So we have COPD. Again, you can tell yourself in your head, just sort of dumb it down. So a lung problem, CHF, a chronic heart problem, appendicitis. We have an acute situation where they have appendicitis, but wait, let's see if these people are a bigger deal that we want to go see first. 2-hour post-op cholecystectomy. So this person just had surgery 2 hours ago. This person had a worse surgery or CABG for the heart, right? 3 days ago. So the way you want to read this is you're the nurse, you've just received report, you have 5 patients. Who are you going to go see first? Now I'm going to see this patient first because they just had surgery and there are complications that can happen right after surgery. So that's kind of how you break it down. Then next would be the appendicitis. Then probably with just this information, I'd see the CABG, and you'd need more information with modifying phrases for that. But that's sort of how you break it down. Okay, I already said that. Okay, so here's another one. So who is the highest priority? A 23-year-old male, we don't care about that, remember, with congestive heart failure, with a potassium level of 5.0 and no ECG changes. chronic renal failure with a creatinine of 0.5 and pink frothy sputum. That sounds maybe more serious. Or acute hepatitis with jaundice and increased ammonia level, who you cannot arouse. So these are all the modifying phrases. Don't care about, don't care about. This, you need to know what your lab values are, but this lets me know that unless this is a big deal, 3.5 to 5.3, it isn't. This is not a big deal. So I'm not worried. This creatinine level, 0.5 to 1.5, there's different scales, but about that. So this is normal, right? Pink frothy sputum is not normal. It makes you think of the lungs, which the lungs are the second most vital organ. It makes you think that there might be a pulmonary embolism. That's a big deal. Or acute hepatitis, not as big of a deal as these diseases with jaundice and increased ammonia level. They don't even give us the level. Who you cannot arouse. I hope you know by now, just by the way I'm saying these modifying phrases, that this one is your priority. Who you cannot arouse. It's the modifying phrase. So again, this is kind of just what I explained up there. And you can slow down and watch this again if that doesn't make sense. Okay, unstable words that kind of give it away for you. Unstable, they might just say unstable. Any acute illness, like I said earlier, post-op less than 12 hours. Anytime a patient's been under general anesthesia in the last 12 hours, they are they're unstable, considered unstable. They might tell you in the question, not ready for discharge, or newly admitted or newly diagnosed. These are all words that equal unstable. Admitted less than 24 hours ago. Something has changed, some new unexpected sign or symptom that they didn't have before. These all you can translate to unstable when you're reading the question. Stable words, they might just say stable. Any chronic illness, like I was kind of showing you up above there, it could be a really serious illness, but it's chronic. It's going to be stable compared to an acute illness, which is unstable. Post-op greater than 12 hours, any sort of local anesthesia, we're not worried the way we are about general anesthesia and complications. If they say ready for discharge, that equals stable. Admitted more than 24 hours ago, nothing's changed. Typical signs and symptoms of what you would expect of the disease or diagnosis, that equals stable. Okay, so another practice, stable or unstable. Kidney stones with severe colicky pain. So have you ever had kidney stones or known anybody who's had them or had a patient? When you have kidney stones, it hurts really bad. So you would expect severe colicky pain. So they're stable. Stable or unstable. Mild pain related to a chest x-ray. Now this is kind of a silly example I wrote for you guys, but would you expect that a chest x-ray, just getting an x-ray, would hurt? No, that's not an expected sign of an x-ray. So that patient now becomes unstable. Silly example, but I just want you to kind of get the point. Okay, here's two more practice ones. Who is the highest priority? A 16-year-old female with meningitis who had a temp of 103.8 since admission 3 days ago. So let's go through our process with this one first. 16-year-old female, I don't care. Meningitis. Okay, so let's say you're not sure what that is. You have an idea though. It means something's inflamed. Oh yeah, the meninges, that's probably in the brain or in the spinal cord, right? Temperature, ooh, that's a high temperature since admission 3 days ago. So this modifying part of the phrase tells me that they are stable as opposed to they just got to the hospital, even though they have this terrible diagnosis. And this is a very high temp. So let's go to the next one and see which one seems more of a priority. 67-year-old male, I don't care, with IBS. That's irritable bowel syndrome. Even if you don't know what that is, who spiked a temperature of 100.3 this afternoon. You wouldn't expect a temperature with this just having irritable bowel syndrome. But the modifying phrase is spiked a temp. Now, even though this is a higher temperature and this is a more serious diagnosis, this is the patient that I want to see first. because this is a new sign and symptom. Something has changed. They just got a fever. And it was not predictable that they would have it with this. Meningitis, you would predict that they would have a fever, and they've been in the hospital for 3 days being watched. So in this case, this one is a priority. Okay, I kind of explained that above. So there's 5 things that are always going to be high priority. Anytime there's a hemorrhage, a fever over 105, that's an emergency situation. Obviously, we're worried about seizures. Hypoglycemia, less than 70. Obviously, hypoglycemia is a medical emergency as opposed to hyperglycemia, which by itself is usually, it is not. Anybody's pulseless, obviously, or breathlessness is going to have priority. These are 5 major priority items. So this is just kind of like when you're triaging what's more important: pulselessness, breathlessness, and fixed and dilated pupils. These are all high priority triage. When you see that in a question, you're worried that this patient is going to die, right? Or is dying. And that's all I have. This is actually a much longer presentation, but what I thought I would do is just kind of break it down for you guys in parts. So hopefully these little tidbits about prioritization and kind of understanding how to read a test question, hopefully that will help you right away. All right, hope you guys have a great week, and I'll be back soon.